Another thing that I would say to you is 35 years ago, one of the first patients I ever treated, an older gentleman, I was bragging about getting a good deal on a pair of shoes. And he said to me, "Don't ever skimp on your shoes or your bed, because if you're not in bed sleeping, you're up walking around." So. Hello, my name is Jeff Petersen. I've been a physical therapist 35 years. We did some estimates. That accounts for about 87,500 visits across about 20,000 individuals. And today, I want to share with you some of the commonly asked questions that I get related to hip pain. We've dealt in past videos, and feel free to go back and watch some of those videos specifically about arthritis and some exercises related to arthritis, as well as some functional tests to see if your hip is involved. But today I want to deal with a question that we get often about pain. So in our first video, we did a little discussion about pain and what pain is, and the definition of pain as an unpleasant emotional experience related to actual or potential tissue damage. And oftentimes people perceive that as me saying that the pain is in their head. And I always say yes and no. All pain is mediated in the central nervous system. Our nervous system either communicates to our muscles or the environment communicates to our central nervous system. It's a two-way street, and those are the only two pathways that we have. So yes, all pain is in the brain, but it is an indicator that there is some tissue damage. There are specific receptors in our body that responds to noxious stimulus, either too much tension, too much compression, or chemical deformation of that tissue, and those nerve endings are going to fire. The challenge is our bodies are not specifically wired, so when there is tissue damage, our brains don't know exactly where it is, so it's just a reference point, and that's where it can get confusing. So it is an emotional response, and to deal with pain, in our practice, we deal with all aspects of pain. But it doesn't mean that there isn't tissue damage, so I wanted to clarify that. The other question I get often is, we get people that are diagnosed with bursitis. It's often used as a term to indicate general hip pain, but sometimes the bursa is in fact the source of pain. So what do you do with that? A common problem with people that have bursitis is they tend to sleep on that side. The bursa is a small fluid-filled sac, and there are a couple of them. And I don't know if Jeremy can zoom in on our poster, but if you look at our poster, there's a picture of the bursa. And as we get older and our muscles start to atrophy and we don't have as much girth to protect our hips, we tend to lie, and we're lying on that side repeatedly, that compression can lead to pain. So exercises can help with that, and feel free to look at our exercise video, particularly the stretching and the bridging, but also rotating the position you sleep in. Another thing that I would say to you is 35 years ago, one of the first patients I ever treated, an older gentleman, I was bragging about getting a good deal on a pair of shoes. And he said to me, "Don't ever skimp on your shoes or your bed, because if you're not in bed sleeping, you're up walking around." So the other thing is to look at your bed and see how many miles are on your bed, and do you need to change it out. So checking your sleep position is a really important thing to do if you have bursitis. The other question we often get is, how do I know it's really in my hip and it's not referred from other areas? So the low back, the sacroiliac joint, those are areas that can certainly refer pain to your hip. So when we talk about the sacroiliac joint, if you look at the pelvis here, you've got the ilium, and it meets, and this sacroiliac joint is a little bit hypermobile. If you've got one of these here where it moves that much, you're certainly going to have pain either in your back or your hip. But you can see the ball and the socket. This hemipelvis is really three bones that make up the pelvis, and they all meet in the socket. So if there's a problem with your sacroiliac joint, that can alter the resting position of your hip, and it can create pain in your hip. So there are specific tests we can go through, and we're going to deal with those in other videos to determine Could it be coming from your sacroiliac joint, the pain that you have in your hip, or could it be coming from an irritation of a nerve root in your low back? And there are tests to indicate that. And that's where, as we talked about in earlier videos, it really is about the pattern of pain. And when you see your physician or physical therapist, they'll take you through a series of tests to try to see what the pattern of pain is to indicate whether or not it's a hip problem or sacroiliac joint problem or in fact a low back problem. The other thing is for arthritis, X-ray and often injection into the hip are kind of the gold standard to see if in fact it's a degenerative hip problem that you're dealing with. So if you have questions and we'd like to have more Q&A sessions, please add them to our Facebook page and we'll address those in future videos. Feel free to like our Facebook page and subscribe to our YouTube channel. And we hope this is helpful in dealing with conditions of your hip. Thanks.